All right, guys, this is Chapter 1, Emergency Medical Care Systems, Research, and Public Health. We're going to go over the EMS Education Standards, Chapter Objectives, Key Terms. All these can be found in your book. We're going to go over the EMS system, what exactly emergency medical technician is, the organization and standards, and EMS research. Okay. So we always start out with a case study. Every Saturday, Ben Melton has breakfast at Dave's Diner, a favorite with locals in the small tourist town. Despite having diabetes and carrying an extra 40 pounds around his waist, 51-year-old Ben finds it hard to pass on Dave's breakfast platter, eggs, steak, and fried potatoes. This morning, by the time his coffee arrives, Ben isn't feeling so great. Just as his friend Arnie notices that Ben has turned pale, breaking into a sweat, Ben collapses, pulling the tablecloth with him to the floor. So what components of the EMS care system must be in place for Ben to receive immediate help? And what kind of weaknesses in a system could decrease Ben's chances of getting help? All right. So, the sudden loss of life or disability from a catastrophic accident and illness is a major public health problem. All right, thousands of people die or suffer permanent harm yearly because of a lack of access to adequate EMS. And as an EMT, you can make a positive difference. So, emergency medical care has developed from the days when the local funeral home was the ambulance provider and patient care did not begin until arrival at the hospital. All right, we learned a lot of lessons through military conflicts, which taught us a lot as far as modern day EMS care goes. All right. Caring for the ill and injured outside of the hospital setting dates back hundreds of years, but the EMS system as we know it began in 1960. The National Highway Traffic Safety Administration provides guidance for EMS systems and EMS education at the federal level. The EMS Agenda for the Future lays out the roadmap for enhancement of EMS education and practices. All right, use the concept. Modern EMS is part of a continuum of care that begins at the scene of the emergency and continues through hospital discharge and rehab. Several significant developments helped lead to this EMS system. All right, CPR was introduced in 1960. In 1966, you had the Highway Safety Act. 1973, you had the EMS System Act, and the National Emergency Medical Services Education and Practice Blueprint was also published in 1993. Please go through your book and check those out. All right, the NTSA, the National Highway Traffic Safety Administration, some of their documents include the EMS Agenda for the Future, EMS Education Agenda for the Future, a systematic approach, National EMS Core Content, and the National EMS Scope of Practice Model. In 2006, the Institute of Medicine reported that the future of EMS care and EMS at the crossroads recommend common scopes of practices to allow reciprocity between states, national accreditation for all paramedic educational programs, and national certification is a prerequisite for state licensure as well as local credentialing. Each state has control of its own EMS system and design and regulations independent of the federal government. However, the NHTSA provides a set of recommended standards called the Technical Assistance Program Assessment Standard. All right, this can be found on pages 3 and 4 of your book. There are 10 components. All right, you have regulation and policy, resource management, human resources and training, transportation, facilities, communications, public information, education, medical direction, trauma systems, and evaluation. Although not a federal standard or document, this text has been identified as one that discusses elements of EMS system design that should be included in EMS system goals. All right, clinical quality, service quality, economic efficiency, accountability, improvement, and resilience. This is your clinical practice and system oversight. Often referred to as the universal number, 911 is the phone number used nationwide to access emergency services, including police, fire, and EMS. The most common 911 system is enhanced. All right, an enhanced 911 system called E911 provides automatic number identification and automatic location identification, which indicates the exact address and phone number from which the call is made. This information is automatically displayed on the computer screen of the call taker, even if the individual calling actually hangs up. All right, that's what a normal communication center looks like. They got a big map. There's their radio system right there. All right, so some of the benefits of 911. The number is easy to remember. Public safety answering point is staffed by specialty trained dispatchers in most locations, however, not all. All emergency services, police, fire, and EMS are accessible by dialing that one number. The FCC has adopted rules to improve the accuracy of location information provided to companies by wireless technology. Okay, they are not, if you call from a cell phone, they cannot, it's not identified as a fixed site, so the location is identified as the closest tower. All right. Voice over Internet protocol services also present challenges to accessing 911 in an emergency. The FCC imposed requirements that these voice over Internet protocol providers must provide 911 service to all customers as a standard feature. Obtain a physical location from the subscriber of where the service will be used. And it has to transmit all 911 calls, including callback numbers and registered locations, to the appropriate public service answering point. All right, so Charlene, one of the waitresses in the restaurant, pulls a cell phone from her pocket and dials 911. The dispatcher immediately transfers the call to a specialty trained emergency medical dispatcher. The EMD asks Charlene a series of questions to help get help on the way and gives her instructions for checking and monitoring Ben's condition until help arrives. All right, what components of the EMS system have been used in this case so far? Regulation and policy, resource management, communication, public information, education. All right, EMTs Julia Smock and Peter Saylor respond to the dispatch heading down Highway 129 towards Dave's Restaurant. An anxious customer holds open the front door as Juliana and Peter pull to a stop in front of the restaurant. Taking a look around the scene, EMTs grab their equipment and head for the door. All right. So what EMTs responsibilities have Juliana and Peter demonstrated so far? They've utilized proper communication in order to reach the appropriate address. They've exercised knowledge of the area, the best route to take to the location. What responsibilities do you predict that they will perform next? They'll start the assessment process of the patient to determine what care to render and what destination facility to transport the patient to. Okay. How will the EMT's appearance and actions determine how they are perceived by others? If the EMTs demonstrate confidence and empathy as well as looking and acting professional, the public will tend to recognize that they are knowledgeable, caring, and experienced. All right, you have several different types of EMS systems, okay? Fire departments, municipal, private, hospital-based, and law enforcement. All of these providers exist across the United States in urban, suburban, and rural areas and industrial settings. They can be quite different in their organization, and each has its own set of advantages and disadvantages. All right, it's defined by the National EMS Scope of Practice model. There are 4 levels of recognized EMS certifications. All right, you have an emergency medical responder, an EMT, an advanced EMT, and a paramedic. Okay. All right, so EMR is down here on the bottom. In this kind of middle tier, you have the EMT, then you have the advanced EMT. I believe they can start IVs and give like some cardiac meds, stuff like that. Then you have the highest level, which is a paramedic. EMS is an integral part of a community's healthcare system, a network of medical care that begins in the field and extends to hospitals and other treatment centers. In essence, EMTs provide pre-hospital care, emergency medical treatment given to patients before they are transported to a hospital or other facilities. In some areas, the term out-of-hospital care is preferred, reflecting a trend towards providing care on the scene with or without subsequent transport to a hospital. Out-of-hospital care also includes care provided during inter-facility transports. All right, you may be required to decide on the facility to which the patient must be transported. The most familiar destination is the hospital emergency department, which is staffed by physicians, nurses, and other trained emergency medical treatment. Here, patients are stabilized and prepared for further care. Some patients may need to be transported to specialty facilities. Around here, we have trauma centers, burn centers, stroke centers, cardiac centers, psychiatric centers. Okay, that's what the inside of a real trauma bay looks like. EMTs often work alongside paramedics and others, fire department, police officers. You interface with team members from other public safety organizations. All right. After quickly determining the nature of Ben's problem, the EMTs head towards the closest hospital, a 35-minute trip, with Juliana behind the wheel and Peter in the back of the ambulance caring for Ben. Having arranged for a paramedic unit to meet them en route, Peter gives the paramedic a quick radio report. How can requesting a paramedic intercept benefit this patient? Okay. So think about that for a minute. All right, what are some of the potential pitfalls in patient safety at this phase of the call? Okay, it could be a time delay, location is missed, or stopping of 2 ambulances, safety hazards. Roles and responsibilities of EMTs extend beyond patient care. Safety of EMS providers comes before patient care. Maintaining one's certification and licensure through continuing education and meeting other criteria are personal responsibilities of the EMT, not the responsibility of the employer or your educational institution. All right, so some of your roles and responsibilities are maintain vehicle and equipment readiness, ensure safety of your crew, the patient and bystanders, operate the emergency vehicle, access the patient, provide emergency care, safely lift and move the patient, prepare oral and written reports, safely transport the patient, transfer patient care, perform record keeping and data collection, and always serve as the patient's advocate. You will be responsible for providing emotional support to the patient, relatives, and others at the scene. Integrate the EMS services with other emergency and non-emergency services. Resolve the emergency incident. Maintain medical and legal standards. Provide administrative support. Enhance professional development. Develop and maintain community relations. All right. You cannot help the patient or other rescuers if you yourself are injured. Okay, we use safe driving habits. Do not enter or stay on an unsafe scene. Be alert to situations with a risk of violence. Any situation can turn violent very, very quickly. Always look around. Always be watching. Okay, wear reflective clothing and protective clothing as indicated. All right. We will gain access to patients, recognize and evaluate problems, provide emergency care, Do a primary assessment, which is identify and manage immediate life threats. And then you do a secondary assessment, which is identify other problems and treat the conditions as you find them. You want to prevent further harm to the patient, prevent yourself from being injured through good body mechanics and have an adequate amount of help. All right. Use the communication equipment available to you to notify the receiving facility of the number of patients, the destinations, and the nature and extent of injuries. Alert the emergency department or receiving facility about high priority patients and what will be needed immediately upon arrival, such as a trauma team or a stroke team. Report changes in the patient's condition and consult medical direction during transport as appropriate and as required. Both verbal and in writing to the appropriate facility personnel what injuries or conditions were identified, what care has been given to the patient, and the patient's response to this treatment. Provide other assistance as needed, and do not leave before the patient has been properly transferred to the care of the receiving facility. Okay. All right, through your shift, maintain an up-to-date log of calls if required. Before leaving the hospital, or as soon as possible, complete the written or electronic pre-hospital care report. As an emergency provider, you are also responsible for protecting the patient's rights. At the scene, collect and safeguard a patient's valuables on their person, transport them with the patient, and document what was given to the emergency department. In the field, protect the patient's privacy, shield the patient as much as possible from curious bystanders, and answer questions truthfully. Conceal the body of a patient who has died from curious onlookers. All right, back to Ben. At the designated point, EMTs meet the paramedic unit and give an update on Ben's status. The paramedic, Alexis, further assesses Ben and implements advanced life support. Following the treatment, which was administered to increase Ben's abnormally slow heart rate, Ben regains consciousness and is confused about what exactly happened. All right, now that Ben is conscious, what do you think are his expectations for how Peter and Alexa interact with him? They're going to be different now that he's conscious versus unresponsive. Okay. How should the nature of those interactions affect the quality of patient care? All right. A number of professional attributes are important to maximize your effectiveness as an EMT. They include appearance, knowledge, skills, the ability to meet physical demands, general interest and temperament, and maintenance of certification and licensure. All right. Some of the things that we need to be aware of is appearance, neat, clean appearance, complete uniform or other appropriate dressing, knowledge and skills, completion of basic training program for EMT, use and maintenance of common emergency equipment, assistance with the administration of medications, cleaning, disinfecting, and sterilization of non-disposable equipment, safety, security measures, territory and terrain, state and local traffic laws and ordinances, lift and carry up to 125 pounds, get eyesight and color vision, communicate effectively both orally and in writing, good hearing. Some of the personal traits: calm and reassuring personality, leadership ability, good judgment, good moral character, stability, adaptability, ability to listen, resourcefulness, and ability to improvise, and cooperativeness. All right. You need to make sure you meet the necessary continuing education requirements, verify skills competency, avoid criminal or unethical behavior, submit all fees to maintain current certification and licensure. And you need effective time management. Always, always, always be a patient advocate. Okay. We've already gone over all these. All right, according to the National Association of State EMS Officials, every state and territory in the United States has a lead EMS agency. The primary responsibilities of the state EMS agency are overall planning of the statewide EMS system, coordination of the statewide EMS system, regulations in the statewide EMS system, and licensing local EMS agencies and personnel. All right, en route to the hospital, Alexis and Peter continue their treatment, and Alexis calls in a report to the receiving facility. Peter continues to reassess Ben and monitor his condition. Alexis begins some preliminary paperwork. All right, what is the legal basis for EMTs providing medical treatment to patients? Is there any kind of legal basis? Can we just go around giving anybody and everybody medical treatment? All right, what mechanisms must be in place to ensure that the care provided is of the highest quality and conforms to the standards of the medical community? All right, there are some things that make sure we do our job. All right, as described under the medical oversight of EMS, it's going to be on page 11 and 12, I believe, in your textbook. The medical director is a physician who is legally responsible for the clinical and patient care aspect of the EMS system. An EMS medical director is responsible for providing medical direction and is also involved in overseeing and providing EMS education program, refresher courses, and continuing education, credentialing providers for the system, and facilitating the quality improvement. Every EMS must have a medical director to provide any level of pre-hospital care. All right, medical direction can be online or offline. Your online medical control is going to be physically talking to that doctor. Your offline is going to be your protocols that you go by, okay? Medical directors should participate in EMS provider education and quality assurance. All right, quality improvement, or QI, also known as continuous quality improvement, is a system of internal and external reviews and audits of all aspects of emergency medical system. To ensure the public receives the highest quality of pre-hospital care, the goals of QI are to identify those aspects of the system that can be improved, and to implement plans and programs that will remedy any shortcomings. It is important to recognize that QI is not designated to evaluate individual performance, but rather is intended to determine how effective this system is and to identify what improvements can be made to deliver better service. All right. You also have roles in QI, okay? Regular skill maintenance, documentation, review and audits, physician, nurse, patient feedback, continuing education. You can take steps to minimize issues in patient safety and medical mistakes. All right. Certain aspects of pre-hospital care are high risk in terms of patient safety. Transfer of care from one provider to another, communications with other providers, carrying and moving patients. All right, ambulance transport destinations, and spine motion restriction decisions. All right, errors during patient care, also putting the patient at risk. These errors usually result from failure of the EMT to properly perform a skill, failure of the EMT to follow the rules, or failure of the EMT to obtain and retain the appropriate knowledge to perform patient care effectively. All right, some of the things that can jeopardize the patient's safety is protocols that aren't very clear. All right. The light at the scene is ineffective. All right. The traditional approach to the practice of medicine involves a combination of a strong foundation of scientific knowledge, intuition, and good judgment. As the medical practice has evolved, the science component has become more emphasized through the concept of evidence-based medicine. Evidence-based medicine focuses on research to provide clear evidence that certain procedures, medications, and equipment improve the patient's outcome. All right, there are 4 steps in evidence-based decision-making. Formulate a question that needs to be answered. Search medical literature for applicable data. Appraise the data for validity and reliability. If the evidence supports a change in the practice, change protocols and implement the change in the pre-hospital emergency care. All right. Research in EMS. Research does not exist to support many practices in EMS. Research in hospital settings does not always transfer very well to the EMS setting. All right. Our setting is very different from an in-hospital setting. If the opportunity arises, every EMT has an obligation to participate in research that continues or contributes to this profession. Evidence-based guidelines take the same approach as evidence-based medicine, using strong, valid research studies to develop guidelines for the medical practice. In EMS, the research is used to develop guidelines, which are best practices, to establish standards of care that impact the delivery of EMS. All right. Changes to the guidelines are based on current research findings that support or reject current practices. Okay. Your book should talk about the FIC EMS and the NEMSAC. All right. The National EMS Advisory Council. All right. All right, National Pre-Hospital Evidence-Based Guideline Model. The process starts with input from national guidelines. Evidence is collected and evaluated. Protocols are developed and disseminated. Following implementation, the process is reviewed for effectiveness. All right. Case study. Ben was seen in the emergency department and then admitted to the cardiac care unit of the hospital. Ben's cardiologist told Ben he was at severe risk for heart problems, but that some of the risk factors can be changed. What are some public health efforts that can help decrease the rate of illnesses like Ben's? All right. What role could EMS providers take in such public health efforts? All right. The majority of EMT's responsibilities are concerned with treating patients who have an acute medical illness or traumatic injury. However, as an EMT, you are also part of the public health team. Public health deals with protecting the health of the entire population. Specific populations are defined differently depending on the issue at hand. The population under consideration may be a selective group, such as children, elderly patients, individuals with mental or physical disabilities, a neighborhood, a state, a city, or an entire nation. 10 greatest public health achievements in the United States in the 20th century. Vaccinations, motor vehicle safety, workplace safety, control of infectious disease, reduction in deaths from coronary heart disease and stroke, safer, more healthful foods, decline in maternal and infant mortality, the use of barrier devices during sex, fluoridation of drinking water, and the reduction in the use of tobacco products. As public health professionals, you may be involved in enforcing laws and regulations that protect the health and ensure the safety of the public. This may be achieved through legislation such as seatbelt and helmet laws. Health prevention and promotion through primary prevention, vaccination, and education, secondary prevention of complications of disease, and health screenings. Disease surveillance through identifying and reporting certain diseases or conditions that are identified as public health issues. Injury prevention through education, promotion of the use of safety equipment such as seatbelts, helmet use, fall prevention, fire prevention, and injury surveillance. Mobile Integrated Healthcare, or MIH, and community paramedicine are the provision of patient-centered health care in the out-of-hospital environment using mobile technology and resources. The mobile integrated healthcare consists of services provided by a variety of healthcare entities and healthcare practitioners that are administratively or clinically integrated with the EMS agency or systems. By contrast, the community paramedic consists of services provided by the EMS agency and its EMS personnel that are administratively and clinically integrated with other healthcare entities. According to the National Association of EMTs 2016 Vision Statement on Mobile Integrated Healthcare and Community Paramedicine, can include the services such as increasing care in underserved areas, providing advice to 911 callers via telephone instead of dispatching resources, using specifically trained EMS personnel to manage patients who are high-volume users of health care or at a higher risk for admission or readmission to a medical facility, to manage chronic disease conditions, and to provide preventative care or post-discharge follow-up instructions. EMS is in a very unique position to contribute significantly to the mission of the mobile integrated health because of its familiarity with and capability to function in the out-of-hospital environment and services of the entire community. EMS can become a significant resource for mobilely integrated health care by transitioning from a focus exclusively on emergency response, emergency care, and transportation to a focus that includes providing patient education, preventative care, chronic disease management, post-discharge follow-up, and alternative health care for patients. By doing so, EMS will significantly increase its value in the healthcare system. All right, after giving a report to the emergency department about Ben's condition and pre-hospital treatment, Alexa compliments Peter and Juliana on their assessment and care. Peter takes the opportunity to ask Alexa a few questions about the patient who present as Ben did. Ben was discharged from the hospital with a cardiac pacemaker to keep his heart beating at the right rate. He participates in cardiac rehabilitation program and is working with a nutritionist on his diet. He still frequents Dave's, but more often than not opts for the bowl of oatmeal with fruit. All right, so summary. The shape of the modern EMS system has been influenced by many events throughout history. EMS system must address 10 specific areas as defined by the National Highway Transportation Safety Administration. 911 is the access number for EMS in the United States. There are 4 nationally recognized levels of EMS providers in the United States. EMTs have several specific responsibilities. Medical direction and QI are essential components of the EMS system. EMS practices change over time based on research findings. All right, EMS is part of the public health system and can make an impact on the health of the community. And mobile integrated healthcare and community paramedicine will continue to evolve and shape EMS.